Back pain is physical, but hugely emotional. The anxiety, the fear of when is it going to return? Is it ever going to get better? Like, how can I get through this when it used to go, and then when it doesn't leave, sometimes feels like you can't move forward with it. Intracept saved my life. I don't have any injury that I know of that was specific to cause it. There was no one moment. I was probably only 22. Every few years, there'd be an extreme few days or a week where it felt like my back would just go out and I became completely immobile. The pain was so severe that I couldn't walk, couldn't make it to the restroom on my own, but it would dissipate. Over the decades, it just got worse. The extreme pain came and it didn't go away. There wasn't just like, oh, a bad weekend or a bad week. It was every day, every morning, nearly impossible to get out of bed, lean forward and brush my teeth, bend down and feed a dog a bowl of food. It was so unbearable, and I could maybe get through about 30 minutes of the morning and then would be flat on my back for hours waiting for it to kind of release, and then I would have maybe not as severe of pain, but pretty strong pain just to get through the day. 2 doctors recommended artificial disc replacement. However, the way our insurance system works, I'd only get one and then the other one would be fused, and that I'm too young for a fusion. But that started to feel really intense and scary and was a very major surgery. In the meantime, was referred to pain management to try and get me through, which is where I met Dr. Naidu.
So Megan came to me 3 years ago, and she was referred by one of my colleagues, spine surgeons, who looked at her MRI, understood her history. When I sat down with her, it was pretty clear and obvious to me that this was vertebrogenic pain. Patients with vertebrogenic pain present with pain with leaning forward or flexion of the spine, pain with sitting, pain with activities such as tying their shoes, putting socks on, gardening, or driving. She had been exploring surgical options. She had exhausted conservative care with physical therapy, medications, just wasn't getting any better, and actually was continuing to see some functional limitations as time went on. With Megan, the day I looked at her MRI was the day I knew she was a great candidate for Intracept, except for the fact that I knew her insurance didn't have a coverage policy for it. And so we submitted for it, hoping to get this approved, but we also had a backup plan, i.e. the epidural steroid injections. Thankfully, she actually did get months of relief with these injections, and so we were buying time as we continued to try to get authorization for Intracept. Then in October of 2023, I received an email stating that this particular carrier was approving the procedure.
Right then, my insurance actually started covering the procedure, and Chris and Naidu had me in there a week later. It's pretty exciting.
Most patients come in and they think, well, there are injections, which we do in a few minutes, and then I go home, and then you have spine surgery. Intracept is in between. It's not as simple as a simple epidural steroid injection, but it's certainly not a major spine surgery. We have to introduce a needle from the back of a patient to that basivertebral nerve inside the bone in the front of the spine. That does require some x-ray for us to visualize everything and safely get it to that target. Then once we get there, we provide 7 to 15 minutes of ablation, and then after that's done, we take everything out. So nothing is left behind, and we've achieved the thermal ablation, which potentially will give that patient long-term relief of their low back pain.
Life without pain is far more peaceful. It's far more exciting. When we plan vacations, there are things that I know I get to participate in now that I didn't used to. We just got back from Costa Rica and I surfed, skiing again, hiking. But honestly, it's the little things. It's being able to do the little things every day that I find to be the most dramatic change.
Historically, you take someone like Megan, it's physical therapy, injections, and then finally they end up getting a surgery. Well, while that surgery might have been helpful with some risk and some significant recovery, what would Megan be like when she's 50 or 60 or 70 having had that surgery? What other things would she have had to gone through?
Things wouldn't have been so great if I was still living in daily extreme pain.
With this therapy, her trajectory in life is completely changed.
Intracept saved my life. That sounds dramatic, but it's absolutely blatantly like the most significant thing that could have happened to me.
Not only have we reduced her suffering, improved her entire social life, family life, personal life, but just think about who she's going to be 10 years from now, 20 years from now, compared to if we had done what we've historically done. That's why this therapy is so special. I mean, it's really changing people's lives in a major way. There are so many thousands of people who could benefit. Navigating this healthcare system, wherever you are, is really challenging. So I'd encourage you, if you're watching this, to find those providers out there. There's a Find a Physician search list, which you can use, and that can help you get to the providers who are doing this and know how to diagnose this particular issue.
I get decades and decades now to continue what is just a normal life.